California becomes first state to offer health insurance to all undocumented migrants. California will become the new year by becoming the first state to offer health insurance for all undocumented immigrants. Starting January 1st, all undocumented migrants, regardless age, will qualify for Medi-Cal, California's version of the federal Medicaid program for people with low incomes. Previously, undocumented migrants were not qualified to receive comprehensive health insurance, but we were allowed to receive emergency and pregnancy-related services under Medi-Cal as long as they met eligibility requirements, including income limits and California residency, in 2014. The final expansion going into effect January 1st will make approximately 700,000 undocumented residents between ages 26 and 49 eligible for full coverage, according to California State Senator María Elena Durazo. This historic investment speaks to California's commitment to health care as a human right, Durazo said in a statement in May. In California, we believe everyone deserves access to quality, affordable health care coverage, regardless of income or migration status, Governor Newsom officer said in response to an ABC News request for comment. Through this expansion, we are making sure families and communities across California are healthier, stronger, and able to get the care they need when they need it. California's plan to expand coverage has not been without its detractors. The California Senate Republican caucus criticized the move in an analysis of the 2022-2023 governor's budget. Medi-Cal is already strained by serving 14 million Californians, more than a third of the state's population. Adding 764,000 more individuals to the system will certainly exacerbate current provider access problems, the caucus wrote last year. However, studies have shown that undocumented migrants use fewer healthcare resources than do non-immigrants. About 50% of undocumented migrant adults in America report being uninsured compared to just 80% of US-born citizens, according to the health policy research nonprofit KFF. Due to undocumented adults being more likely to work jobs that don't provide health benefits, as well as facing eligibility restrictions for federal programs. Additionally, undocumented migrants who are eligible may face other barriers, including confusion about eligibility, language challenges, and fear, KFF said. This is despite low-income undocumented migrants in California being about as likely as those currently enrolled in Medi-Cal to have at least one chronic condition, according to research conducted by the Public Policy Institute of California, PPIC, a non-profit research institution. Undocumented migrants are also about as likely to receive preventive services such as the flu shot, and older undocumented migrants are about as likely to receive age-appropriate health services such as cancer screenings and the shingles vaccine at rates similar to Medi-Cal patients, the PPIC found. The California Health and Human Services Agency has committed $835 million in 2023-2024 and $2.6 billion annually thereafter to expand full-scope medical eligibility to all income-eligible adults, regardless of migration status. When California expanded health care coverage in 2019 to include undocumented young adults, then President Donald Trump blasted the plan, calling it very unfair to our citizens. If you look at what they are doing in California, how they are treating people, they don't treat their people as well as they treat legal migrants, Trump told reporters at the time. So At what point does it stop? It's crazy what they're doing. It's crazy, and it's very unfair to our citizens.